Now let's come to the flat tympanogram or the type B tympanogram. In type B tympanogram or flat tympanogram, you can see that there is no peak. And you can see that there is no movement of the TM, no best TM movement at any pressure level, neither at the negative pressure levels nor at the positive ones. So flat tympanogram, it actually means two things. One thing is either there is fluid in the middle ear, okay? Fluid in middle ear that is preventing maximum movement of the tympanic membrane, or there is no tympanic membrane, because if there will be no tympanic membrane, or in other words there is a perforation in the tympanic membrane, what will happen? The probe will not record any movement of the tympanic membrane. So it will result in a flat tympanogram. Now see, like I've mentioned here, when the tympanogram is flat, it usually means one of the three things. Okay, we have added three things as well. It can be an artifact, it can be fluid in the middle ear, and there can be perforation. So now you should tell me that in which condition there is fluid in the middle ear. There can be thick fluid, there can be thin fluid. So fluid in the middle ear, it occurs in a disease that is called otitis media with effusion. In otitis media with effusion, what happens is that the middle ear is chronically, it is filled with thick fluid that is mucoid, or there can be thin fluid that is serous fluid. So it results in type B tympanogram. And in which conditions there is perforation? Perforation can be in traumatic perforation. It can be in a disease that is called COM, very important and more common than traumatic perforations. And COM is what? It is chronic otitis media. This is a chronic condition of the middle ear, and there can be perforation as well in this condition. So how do you differentiate if this condition or this tympanogram is because of ischemia or this is because of chronic otitis media? You will look at the EAM volume, the external auditory meatus volume. If it is large, it means there is perforation, and if it is normal, it means there is fluid in the middle ear. So why is it so? What happens is that when your probe, it is automatically recording what? It is automatically, recording the volume of the external auditory meatus. Now this is the middle ear. If there is perforation in the middle ear, if there is perforation in the tympanic membrane, it will also include the volume that is present inside the middle ear. So it will give a large external auditory meatus volume. It would mean that there is a perforation present in the tympanic membrane. If there is no perforation, then it will only record the volume that is in the external auditory meatus. That will mean that there is some fluid that is present in the middle ear cleft. This is how you will differentiate if the flat tympanogram is due to a perforation or fluid. Now, The third type of tympanogram, that is type C tympanogram. Type C tympanogram has no changes in the peak, or it is not flat. It is not flat. There are no changes in the peak, but the peak is, instead of being present at 0, it is present in the negative pressure side. So why is that? Because the best movement of the drum occurs when there is negative pressure in the external auditory meatus. Thus, middle ear pressure must be less than the atmospheric pressure. In which disease this occurs? This occurs in any middle ear condition that results in negative pressure in the middle ear. And in early stages of otitis media with effusion, what happens is there is negative pressure in the middle ear cleft. Later on, due to negative pressure, there is extravasation of the fluid from the blood vessels that are present in the middle ear mucosa, and that fluid, it keeps on collecting, and then it can give rise to otitis media with effusion, a full-blown condition. And that will show you a type B, the flat tympanogram. But in the early stages, there is the negative tympanogram, that is type C. And type C, it can be further divided into C1 and C2. C1 is when the peak is between 0 to 200 delta pascals. This is when it is C1. And when the peak is less than minus 200 delta pascals, then it is more severe. It will be type C2. So now we know all the types of tympanogram in detail. I will quickly review all these types on this combined tympanogram. This is type A tympanogram. This is a normal tympanogram with normal compliance peak that is occurring at 0 delta pascals level. And this is the type AS tympanogram. This AS tympanogram, there is decreased compliance of the TM, but the peak is at 0. This is type BAD that occurs in ossicular disruption, and it has an unusually high compliance, but the peak is still at 0. Now we see this curve, this dotted line curve. This is a flat tympanogram, or the type B tympanogram, that occurs in what? 3 things. It can be an artifact, it can be otitis media with effusion, or it can be in perforated TM conditions. And this is type C tympanogram. The peak is normal. See, you can compare it with type A. The peak is normal, but the peak is occurring in the negative pressure. So this is all about tympanograms. If you have any questions, you can ask your questions in the comment below. And thank you for watching me. Bye.